Hello, everybody. Thanks, Supervisor Cannon, for giving me the opportunity to come up here and speak. And thank you for the presentations beforehand. That was a lot of good information. I think there is a lot to understand about the different laws and different things being put in place. Although there's a lot of detail, I think the one thing to understand is that there's been a lot of people who've taken the time to decipher and figure out a lot of these different issues that come up throughout the cannabis industry. So I think that we've come a long way from 2008 where we started, and I'll tell you a little bit about the experience that I've had and with my patients mainly. But I'd like to just give you a little brief introduction about cannabis itself, maybe dispel some of the rumors and the myths, and kind of give you an actual idea of how we apply it as a science in the medical practice. So myself, I'm an internal medicine physician. I've been specializing in medical cannabis more recently since 2010. I studied at Wayne State University for my undergrad. I did my medical school at Michigan State University, and I trained at Henry Ford Health System. So I've been pretty much in the Detroit area for most of my training and practice. I practice at Henry Ford Wyandotte. I have my own private practice clinic. I'm a medical cannabis director at the Insight Institute for Neurosurgery and Neuroscience. I'm an assistant clinical professor at the Michigan State University College of Osteopathic as well as the College of Human Medicine. I'm also on staff at the Huda Clinic. So I've had a lot of different experiences and had a lot of different opportunities to experience the medical field as well as how to apply this specific medication. So to just give you a little overview, I'll go through some of these things quickly as some of them might be a little bit more detailed, but I'm very happy to answer any questions about the specifics of the science or anything afterwards as well. So cannabis, we've had evidence of cannabis existing as far back as 12,000 years ago, so that just tells you that this plant has been present on our planet for a very long time. There's documentations of use of cannabis in medicinal Chinese pharmacopoeias, and they used it mainly as an analgesic for labor. This also back in 2000 BCE in ancient Hindu text as well from the India area. And more recently, we can skip forward, the more important thing is that it was all legal until about 1970 when cannabis federally was placed on as a Schedule I drug and kind of decided to have no medicinal value. It's just a quick picture of the plant and the flower itself. This is what we kind of are discussing and talking about in general. These little spots that you see with the arrows pointing onto them, those are the sugars that are produced by the flower itself. This contains all the cannabinoids, THCs, and different compounds that the plant actually makes, and this is what's actually of medicinal value to us. Two distinct strains, cannabis sativa, cannabis indica. These are the different terms that you may hear about the different types of genetic strains of cannabis itself. From here come all the crossbreeding and all the interesting names that you pretty much hear when cannabis is referred to. The active compounds are cannabinoids. Delta-9 tetrahydrocannabinol is the one of interest for us, but it's also what classifies this as a Schedule I drug. There's lots of medicinal properties as well as the euphoric and psychoactive component is in the delta-9 tetrahydrocannabinol, which we also call THC. Cannabidiol, these other terms, the CBC, CBN, these are all different compounds that are also found in cannabis and the cannabinoids that are produced by the plant itself. They have non-psychoactive components, but they also have various medicinal properties. And last, we have terpenes. These are molecules that give fragrance and taste, but they also have medicinal properties separate from THC, and those are being more studied and understood now. This is just a little chart to kind of show you all the different areas where cannabis has its effects. These different terms, the CBD and CBDA and CBC, are a little bit more detailed discussions about cannabis itself, but the important thing to take away here is that you have different components of cannabis that produce all the different types of benefits that you have. So there's not only just one component of the plant or any one part of these compounds that you can isolate and just use medicinally. The cannabinoid system, we have our own endocannabinoid system. These are receptors in our body. They're located throughout various tissue in our brain, our smooth muscles. And these are the cannabinoids that we produce work on these receptors, CB1 and CB2. Outside of that, you would have the effects of these are actually unable to produce any life-threatening complications, mainly because these CB1 and CB2 receptors do not exist in the portions of your brainstem that control your vital organs like heart rate, blood pressure, and respiratory rate. So there's no known dose limit or overdose set amount that has ever been discovered or actually even potentially been reached. Here's a little bit more detail about the science of this, just to kind of give you an idea that there are chemical reactions and different things that happen between synapses. So these are just different terminals of our nerves where they end and signals actually pass through. And these different chemicals and the way that they act on these receptors are what change or modify the different chemicals that are released and changing the signals that go between the nerves. Again, those are some more detailed things, but if there's someone that's interested, I'd be happy to go over that in more detail. So pharmacokinetics, basically cannabis can be smoked, it can be vaporized. Those are the two inhaled forms of cannabis. These produce a quick rapid absorption, and they act quickly on specific areas, especially the brain and internal organs, as that's where most of the circulation takes the concentrated THC, which you would absorb in your lungs. So you have a distribution which is really time dependent, and metabolism occurs in the liver mainly, and you have a few different chemical reactions that happen, and you have multiple metabolites. This is what we usually use in drug screenings. So cannabis and what we use it for now. The state of Michigan has allowed us to recommend cannabis for these particular conditions, category A, B, and C. A are these specific conditions that are used for cannabis or approved for cannabis, and then category B is a symptom or condition that would be a result of a treatment or a medical problem, which is pretty prevalent among most medical issues. Category C is designed to add other conditions as the state board approves them. The one that's been approved is post-traumatic stress disorder. So we have cannabis for pain management. This is probably the main area of patients that I see, mostly dealing with pain from multiple different reasons, whether it be from major trauma down to smaller injuries and different issues that people end up putting on narcotics and different medications for that. So in this area, we found that it's had an improved efficacy in decreasing fatigue, which results in a lot of decreased pain. And we can treat the side effects from beneficial medications. So sometimes we have patients that need to be on certain medications but don't tolerate it because of neuropathies and different issues that come along. And so we've used cannabis in a lot of those areas to make the primary treatment more effective. We've also used it prior to physical therapy, occupational therapy. We're using it currently in inpatient rehab to help with improving mobility, spasticity, and muscle spasms to improve the physical and occupational therapy of the patients. We've also seen a major reduction in anxiety that comes along a lot with the chronic pain issues that most people deal with. Neurological disorders, this is probably the most interesting area of cannabis use currently. We've had a lot of developments in using it in MS, especially with all the different symptoms that occur with MS. This is not a disease-modifying agent, so it doesn't particularly change or treat a disease. However, it does help with the symptoms that occur from it. MS produces a few different types of symptoms. The nice thing is that cannabis kind of works for all these different ones depending on which combination that the patient might be dealing with. We've used it in Huntington's disease, and of course seizure frequency in epilepsy has been significantly reduced, especially in frontal cortex, cerebral focus seizures. or epilepsy. So cannabis for cancer, first thing I want to say is it is not a cure for cancer. There is some evidence that warrants further studies and shows some positive signs for anti-neoplastic properties, but these have to really be studied and understood much better in order to be considered as a treatment or a cure for cancer. However, we do use it in the patients with cancer, mainly used for a variety of different symptoms, not only from the treatments itself, but the tumors or the disease process itself can create a lot of different pain issues and digestive issues, a variety of different symptoms that it helps with quite a bit. It usually has a good effect on improving the patient's nutrition and appetite stimulation, which is usually a major issue. Dosing, so I know we get into all these different legal issues and how much someone allowed to carry and all those kind of things, but the thing here is that there is no specific dosing guideline. So, cannabis doesn't come with an insert that says use this much, or this much will kill you, or this much is going to cause renal failure, primarily because we don't have those side effects, but a lot of the information has not been studied or really understood to the point where we can dose it or prescribe it in a particular way. Like I said before, there's no toxic limits or direct effects on heart rate, respiratory rate, temperature, or blood pressure. The major adverse effects are short-term memory loss, which is limited to the times of use. In very rare cases, there have been some reports of cyclic vomiting syndrome as an associated condition, but has not been directly linked. Again, there's been no reported deaths of any amount of cannabis use. A lethal dose is estimated to be 30 milligrams per kilogram of IV administration, which we have no way of even achieving or administering at this point. But that was based on something they did on mice, and so they extrapolated this data, but I just thought to throw it out there. There's no other known drug interaction, so it's very easy to use in practice. We can apply it to pretty much any patient that's taking any combination of medication, and we haven't had one issue with any kind of interactions or anything like that. In most cases, we're reducing their other medications. So what does a patient have to do? A patient comes in, they get evaluated, we review their conditions, their medical records, and we go through the recommendation process. We educate and teach the patients on the use of cannabis. So as much as there's a lot of people that have used cannabis previously, and a large number of those patients may be mixed in with some recreational people, but there's a lot of patients that have never used cannabis. And that's a very small representation of the total number of patients that could actually find benefit. So we're talking about millions of patients with different symptoms and different things, and we're talking about registry of maybe a very small fraction or percentage of that. So really what I'm doing is out there going and educating different physicians, different people on the different medicinal uses of cannabis. And we talk about the medicinal uses of cannabis, we're not talking about teaching them how to roll a joint. We're not teaching them how to use a bong or any of those kind of things. It's come a long way. We have milligram dosed capsules. We have concentrated liquids, so we have metered amounts of concentrate that's in a vaporizing pen. So very clean and easy ways and practical ways to use cannabis. And that's really kind of the mainstay of where the medicine portion of this is kind of going. And a lot of that had to be developed. A few of these things weren't really available in the last year or so. These are all kind of things that are kind of newer, and so we've had quite a widening of the application of cannabis. And we provide those referrals to qualified individuals. Again, that is another area where my patients have a lot of issues. There's not a lot of qualified health professionals or other individuals who can understand patients' needs and actual health care in order to develop and produce the right types of treatment. So facilities that produce those types of access points where patients can get their medication, learn about cannabis, and use it effectively and safely are very important. It becomes very difficult as a practicing physician when the closest place to get something is 15 miles away. Most municipalities and a lot of different communities are thinking about how to opt in and how to opt out of this whole situation. But one thing I think is most important is the patients need access. There are a lot of different issues with children access and teenage use and a lot of those other things, but I'm here talking about the patients who are really sick, who need the medication, who are allowed to use it but have no access. To the other presenters' points as well, the law wasn't very well thought out. When it was first written, I don't believe that it was written by any healthcare professionals or physicians to begin with, because it actually required me to recommend to have a 6-year-old child, which is part of the age range which I deal with, and they would have to smoke the cannabis. And that does not make any practical sense from that standpoint. So we've come a long way in making these advancements and understanding how to practically apply this and use this. But there is these last few key pieces of how this works in a community. And I have many patients in this community. I have many patients in all of Southeast Detroit, as well as all the way up from Traverse City down to Monroe County. So you know, the access is very limited, and these are one of the areas where I think we need to pay particular attention. Again, and when I talk about access points, I'm not talking about these same facilities that you kind of see out there. We're not talking about neon signs and green lights. We're talking about something just like a CVS, where you would go and get your other prescription medications. We have lots of problems with the overprescription and overuse of narcotic medications and opioids, and those are producing major epidemics of heroin abuse and overdose. And that's actually resulting in deaths. However, we don't limit or say that CVS cannot be here. We don't limit how many CVSs are in our communities. That's a business decision, and things are done by other situations. And I think it would be wrong for us to not allow some of these important facilities to be there as different ways to use these medications. Doctors are prescribing less and less opiates now because of these different pressures and issues that are going on, and patients are now left without relief. They have no pain medications, sometimes appropriately, sometimes not appropriately, but they get caught up in the whole situation of the people doing things wrong affecting the people doing things right. So that's kind of my thing to really say and kind of let you everybody know about, because that a lot of times the patients really don't ever have an advocate. A lot of big business, a lot of big interests definitely come and can put on good presentations, but we still need someone to think about those patients, the ill people who are really getting benefit from this. And this number is exponentially increasing outside of just the registered patients and different things that we're going. The medical community is seeing a very large rise and an influx in people interested in cannabis and looking for alternative treatments. I think otherwise I have some sources here, and that was about it.